is Rachel Hedden. I'm going to be talking with you today about intimate partner violence in the emergency department, as this was my focus area for the practicum. I first want to review the literature that I found, which was through CINAHL and Google Scholar I focused on. There are thousands of articles with emergency department and intimate partner violence in both databases, and I limited the searches to a few criteria. But I want to talk to you about what I found as far as the effects of intimate partner violence, which can be physical, emotional, or psychological. Some discussed key concepts within all of the articles were things like screening tools. Domestic violence is another term that is used for intimate partner violence. Substance abuse, pregnancy, and early intervention and screening tools, which some of the screening tools are abuse assessment screen, humiliation, afraid, rape, kick, also known as HARC, ongoing violence assessment tool, and women's experience with battering, also known as WEB. These are some of the few tools that are used. Some of the efficacy of different screening tools were also discussed within the literature, among many other topics. It's a very broad topic that has also been seen with this topic. It is reported that short, simple, and sensitive intimate partner violence screening tools are the most effective in helping to detect abuse in the emergency department. So that's kind of the bottom line of the literature review. There are some ENA guidelines, the Emergency Nurse Association guidelines, that have been published, which are that bottom line, healthcare providers should be well-trained and knowledgeable to respond to intimate partner violence and be able to detect that. They suggest that universal screening, it should be for all patients, anyone walking through those emergency room doors. And the WHO, World Health Organization, also put out some guidelines, and they said ask and educate patients on intimate partner violence, but also that screening should mostly be done on high-risk patients. So they don't say that universal screening is recommended, but mostly screening for high-risk patients they found to be the most effective. So there's a bit of contrast there. Some key points of the focus area of my particular emergency department is that at Sturdy, there is a universal screening tool that they use, and it's that everyone should be screened walking through the doors. There is a policy in place for such instances that there are positive detections of the intimate partner violence. There's a whole policy on what to do and who to refer them to, resources, that sort of thing. And like I said, there's many resources that they can use to help these patients remove themselves from the harmful situations. I want to talk to you about the 3 patients that I was able to talk to during this practicum experience. They actually weren't through the practicum, it was through work, because I work also at this place, Sturdy. But I was able to talk to 3 patients that did have positive history of intimate partner violence. 2 of them were women, 1 of them was a man. 2 of the 3 did reach out to ask for additional resources and get that help that they needed. One of them, the third one, was still unsure if she wanted the help and wasn't quite sure if she wanted him out of his life. And at that time, it wasn't the top concern. The top concern for her at that point was that she was suicidal, so we needed to address her mental health before removing her from the home completely, because she was going to go to an inpatient psych unit, so she would be safe there. And then they would address her going home there. And community resources. I also want to talk to you about the implementation of the SANE-CART that I did at the emergency department that I worked, or that I did the practicum with. This cart is used for sexual assault cases. The resource book on the top right is what I put together. It's got many resources. It's got handouts for nurses. It's got handout for patients. It's got the whole process of how to do the kit. The manila envelopes are used to seal and send medical records for safekeeping. I updated the log sheet. The top left and the bottom left are both two of the drawers that have a lot of the extra resources that one might need to do the kit, and the bottom right is of resources that would be sent home with the patient. So there are folders there, and in the folders there's resources such as how to reach out to a lawyer if they want to press charges, safe places that they can go, HIV clinics, sexual STD clinics that they can follow up with that are free. And there's panties, there's shirts, there's underwear, there's toothbrushes, chapsticks, all the sort of things that someone might need to go home that would be in the bottom right. I appreciate you taking the time to listen to this, and I hope you learned something through this. Thank you.